given the competition that's around us, given the fact that we're probably going to be Medicare, Medicaid reimbursements are going to be lower, given the fact that most people go elsewhere for acute care, why are we even looking at competing with Lake Granbury or Walls or whatever? Why not scale back our expectations to what we can do to serve the residents of this county better in terms of giving them the best health care we have to offer? And I understand, there's a difference between people getting good health care and the business of health care. And I've really kind of lost that focus on the actual health care tonight. And I think my thought is, do I want to spend money for, oncology services, my tax money for oncology services or cardiac services or whatever when, odds are if I have a stroke or a heart attack or in a horrible accident, I'll be airlifted to Arlington or Fort Worth anyway. I mean, some sense of perspective here on what we're really trying to accomplish.
Well, our strategy with our board and management is to provide health care services in a rural community at a quality level and not go beyond that with the higher level of services, the trauma, the cardiology. We've not done that. And we're not going to do that. But, it's necessary in technology to have a CT scanner. If you're going to run an emergency room, you got to have a CT scanner. You don't want to come with a head injury, not have a CT scanner and send them up to a trauma facility to find out that the CT scan comes back normal. You've gone through all this high expenses to send somebody out. What we got to do is take the level of service we provide, basic inpatient, basic cardiology services, urology services, and provide those at the best level that we can. It's hard to say I'm going to provide a lower level than that.
Okay, can that be done at the cost at a reasonable cost without losses?
What you see is
you're not going to be having the same situations in future years as you did this year, more likely.
What you see is that you're going to lose business. When you lose business, your revenues are going to go down, your expenses, are going to stay at the same level. You've got to provide some level of services that are going to cost you a basic level of expenses.
Exactly, but if we're establishing a hospital district in order to compete with Lake Granbury Medical Center or the ambulatory surgical centers surrounding us, I think that's throwing good money after that. If we have a level of basic services for the people of our county, that ought to be plenty enough.